Welcome to the Startup Support Surgery podcast, where we light the entrepreneurial spark in medics and healthcare professionals. Join me, Dr. Joe Watkins, GP, business coach and co-founder of The How People, on a journey to discover where your medical know-how meets the business world. This will help you find some clarity on how to balance work, passions and family so that you can gain more freedom and control over your life, but also continue to help people, which is actually why most of us went into medicine to start with. Embarking on this entrepreneurial adventure is not easy. It is a roller coaster of emotions, but it's hugely rewarding and exciting in the process. Drawing on my 20 years of blending medicine and business as a GP, I am here to share experiences, insights and lessons. Expect lively chats, expert interviews and real-life stories from medics who have taken their own path. Let's break free from traditional healthcare norms and explore more innovative ways of making a real difference to people's health and well-being, along with paving the way for a brighter future for us as healthcare professionals. Oh, don't miss my free PDF called From Stethoscope to Startup, which is an 11-page guide in the show notes full of practical help and advice. This is your roadmap to kickstarting your journey with us. Enjoy the show. I'm delighted to welcome Dr. Richard Pemberton to the podcast today. He is co-founder and director of Hexagon Health Ltd. Richard is a certified lifestyle medicine physician, an occupational physician, and a GP who has dedicated his career to improving the health and well-being of others. With over 25 years experience, he continues to pursue his interest in lifestyle and individualized medicine, working with two friends and colleagues, Vian and Kate, as part of Hexagon Health. We're going to find out all about this today. We're going to hear about the highs and the lows of running a business with friends. We're going to hear about the financials. We're going to hear about his advice to his early entrepreneurial self. This is a really valuable discussion, and we touch a lot in this discussion on how Hexagon Health Limited and Hexagon Health Alliance can help anybody with their CQC requirements. So if you are a lifestyle medicine physician and if you are looking at going out there and practicing, please have a listen and get in contact with Richard. In his free time, Richard loves to stay active with cycling and walking and also has a private pilot's license. Who knew, Richard?
Who knew?
I love it. I love your fact. When did you last go out on your plane?
Not so long ago, but I love it. It's a bit of a geeky, expensive hobby, but yeah, it's good. Yeah, I love it.
Amazing. It's properly geeky and properly expensive, I would imagine.
Yeah, I've loved it since I was a child. So it was one of those things I always wanted to do. So I just took the plunge and went for it.
Awesome. Brilliant. Well, thank you so much for being here on behalf of the three of you. I love you guys. We were neighbours at the BSLM conference. We've spent a lovely weekend up in North Wales together, and I think you're amazing. So I'm really, really excited about having you here today.
Thank you. I'm very excited to be here.
Good stuff. So why don't you explain in your words what Hexagon Health is all about, who you help and how you help them?
Sure. So Hexagon Health was essentially something we started during a conversation about 4 years ago now, actually, after the BSLM conference in Edinburgh. So I was there and I'd worked with my colleague Vian for over 10 years as a GP partner on the outskirts of Cardiff. I left there about 12 years ago, loosely kept in touch with V, and then V introduced me to lifestyle medicine, and my life has never been the same. So I did the diploma in 2021 or something like that. And then we went to the pub afterwards and we got chatting, and V had also spoken to one of her friends, Kate, who I had known of but never actually met when I was working in Cardiff. So she lives in Windsor. So the three of us got together, and after a couple of Prosecco's, we kind of said, what about doing this? What are we going to do with our diplomas when we've actually got them? So we decided to start Hexagon Health, and then realized that it's a bigger thing than you think, setting up a company, as you will know better than I do, Joe, but it's a huge thing. So that's essentially how we come up with the concept of Hexagon Health. And Hexagon, because in lifestyle medicine, there are 6 pillars. So we thought we'd go for the 6 pillars and use Hexagon Health as the title.
Fantastic. I love it. And I love the fact that you guys have got a bit of history, because I think that is really palpable when you come into your world. There's obviously, lots of stories. You know each other well, your families know each other well. And I think that shows the sort of integrity of your business.
Thank you. Yeah. And I think one of the things we really wanted to do is, as GPs, and we've been in the profession 25 plus years, and suddenly you start to get, when you do, or when you learn a little bit more about lifestyle medicine, you realize it really challenges your conventional thinking about medicine. And actually it starts to change it from a more, the biopsychosocial model in terms of, okay, here's a set of symptoms, this is the disease, and here's the treatment. It changes it a lot to, actually, how can we prevent people getting there in the first place, and how can we improve longevity? So one of our mottos, if you like, is to uncover risk and prevent disease. So that's, you asked kind of what's our typical patient group, and that's what we're looking for. We're looking to identify people who are thinking about their long-term health, worried about the risk of chronic disease. People who've got family members who've just been recently diagnosed with chronic disease like dementia or cancer or diabetes and heart disease, that kind of thing. And we're helping them to identify what their risk is, so uncover the risk, and actually then help them to prevent disease using a lifestyle approach. So that's the essence of what we're about.
Fabulous. And we met, I can't really remember how we met, but we met, I think it was about a year ago, and you've been part of the kind of initial program that I started with BSLM. I think it was January last year. Do you remember that period of time, what you were looking for, where you were stuck? Did Kate just come along and say, guys, I'm sorry, this is happening? Or was it something that were you coming across blocks that you were looking for answers for?
So we kind of haven't had an idea, and you have to remember the three of us have full-time jobs. So it was very much, I don't know, I think our spouses may think Hexagon Health was more of an expensive hobby than anything else. But actually it was a little bit more than that. What happened was, we were really trying to understand what we may be able to do for people. And some of that was a life coaching approach. Some of that was counseling. Some of that was just seeing people, and then trying to understand, actually, if we really want to major on uncovering risk, we're going to have to do blood tests here. So the blood test approach made us have to start to think about CQC. And suddenly it started to become a little bit overwhelming, even for the three of us. So we're kind of thinking, okay, what's happening? So we started last January to start our clinics, and we weren't really gaining much traction in terms of seeing patients come through the door. And I think that's the other thing. When you start a business, you suddenly think, I've got such a good idea, and when you start, you expect the floodgates to open and suddenly you're going to be as busy as anything. And that isn't the case at all. So Kate, who we're going to call our marketing guru, she introduced us to SUS and what Joe is all about. And she enrolled with V on this modular program that you do. And it really, really, really benefited them in particular. I did a couple of the modules, but I think I was more interested in coming to the retreat that you ran in Bala. And obviously, that was the most hilarious experience ever, because it was amazing, really, really amazing. It was a very cathartic time for me as well. But I turned up and suddenly I'm with 32 other women, and I'm the only man. And I remember phoning my wife to say I've got here, and my wife was hearing all these girls in the bar there and regressing into medical student days, as we all do when we're together. And she said, "What's going on?" And I said, "Alia, I'm the only man here, and there are 32 other women." And she's like, "It sounds like you gate crashed a hen party." And I said, "That's exactly how it feels." So anyway, it was brilliant. There was a time of reflection, there was a time of walking, there was yoga, there was really, honestly, I can't commend you enough for that. That was absolutely life-changing in terms of just being able to do things. You probably remember on the last day, I was even cutting out pictures and sticking it into one of those mind boards or whatever they are.
Yeah, you were a reformed character. You were absolutely
totally reformed. Really helped me, actually. Maybe it brought out a bit of my feminine side, I don't know. But it it was really good there was obviously a serious note in terms of the marketing. There was a serious note, I'll call it serious, in terms of a retreat, in terms of people just coming together and sharing what they have in common. And I think the other thing for me was just the whole, I don't know, it was just an opportunity to speak to people who were in the same position that we've been in terms of working in the NHS and working in the NHS for so long. And I remember speaking to this one doctor who said, oh yeah, I've just left the NHS. And I said, oh, how did you feel about it? Because if you'd cut through me 10 years ago, you would have seen like rock the words NHS. I was a core NHS. And if you don't want to be that, then you're useless. How I've changed in that regard. But she said, no, I've left because it made me feel like I was in an abusive relationship. And, we use that term and you think coercion, manipulation. Oh my gosh, this is me. I've been in an abusive relationship, working when you shouldn't really be working, taking work home, the impact that has on the family, the impact that has on the rest of you, in terms of family life and all of that. And suddenly you think, yeah, gosh, yeah, it suddenly hit me that it felt like I'd been in an abusive relationship. And maybe that's one of the points that I took home is just, wow, yeah, there are so many of us out there who feel the same. And it just actually spurred me on to want to make something outside of the NHS succeed. So yeah, that was a really important time for us. So that's how I met you. And then obviously we had the SLM, the conference together. So we were sharing information between our stalls and that kind of thing. And that was a really good time. And every time we meet and communicate, it always feels that we come a little bit closer together, doesn't it? So it's
absolutely. No, I love it. And it's really lovely to hear you talk like that about the retreat, because it was very much an in-house thing. It was the first time I'd ever done anything. And I think, I have nerves like everybody else. And I think I always worry, well, will people really want to come? And why would anyone want to listen to me or be there for me? And it was fantastic. It was really, really special weekend with Emma Presson, rebellious medic, who's, most people will know about. She's done a couple of episodes with me, going up to her place, having a walk, spending time outside, jumping in the lake. It was fabulous. And for anyone listening to this before October 2025, we're going to do a South Wales version in St David's, which we have done before with the Welsh Lifestyle Medicine Network. And this is going to be more for everybody within that Doctors Doing Differently community, focusing on creativity and outdoors. And it's just a really fun way of, like you say, exploring different things that you wouldn't do otherwise with like-minded people. So thank you for sharing that. I think there's so much I want to talk about. I want to talk about working with friends. I want to talk about what you've learned, but I want you to explain to me, because I know Hexagon Health is now kind of, there are different parts to it. There is the lifestyle medicine part to it, and you talked about risk and disease, but I know there's also another part to it that lots of people ask me about, because you mentioned the dreaded 3-letter word that is CQC, and anybody that's coming out of lifestyle medicine, any medic who is wanting to go out there and help people in a different way, faces this CQC conundrum. So can you talk us through sort of how Hexagon Health works, and then can we go deeper into the CQC thing?
So if you wanted to, because we're regulated, because we're on the GMC register, and it's the same for the nurses as well, because they're on the NMC register, we're heavily regulated in what we can do. And, we all sign up to appraisals and revalidation and all that kind of stuff. The biggest hindrance is if you want to treat disease, disorder, or injury, that's how CQC define it, or if you want to use any diagnostic or screening procedure. So if you want to do a blood test or take blood off a patient, you need CQC. So the whole thing really is, we went on this journey of trying to argue, could we do it? Could we not do it? We emailed lots of different organizations to say, do we really need this? We're doctors, we've been doing this for some time. And every single one of them came back and said, yes, you need it. So we spoke to the CQC and they said, yes, you need it. So we embarked on that process, and an expensive process because you have to. We went through a compliance company to help us with setting it up. That's a long process. It takes several months. Then you have to apply. Then you have to be inspected through an initial inspector, and then you have and then you're granted the accreditation or not really. So when we got this, or during the process of getting this, I can't remember who had the brainwave. I don't think it was me. It was probably Kate. But although I think V has been there somewhere along the way, she's I call her our Uranus thinker, because she is universal in where she wants to be and where she wants to go. And I'm a little bit like, can't we just finish where we are at the moment, please? And so you need people like that spurring you on and driving you forward. So when we got to that stage, we thought, hang on a minute, if we've got it, all these other doctors who are coming out of a BSLM with their core accreditation or their diploma will also need to have some form of it. And I remember being in one of the CQC seminars in BSLM a couple of years ago, and doctors were just arguing with the CQC inspector about, no, we don't need it. I don't know what you're talking about. And anyway, I later found out she's the head of inspectors. She was the chief. So it was a little bit like, I don't know why people are trying to argue, but that's how it is. And in some ways, I guess it's one of those things. So what we decided is whether we could open it up and form what's called a Hexagon Health Alliance. So the Hexagon Health Alliance is something that we've created to try and allow other doctors, nurses, health professionals to come under an umbrella, if you like, to associate with Hexagon Health, to be able to provide services, exactly what we provide in their localities. Because obviously we're based in 3 geographical locations. I'm in Leicestershire in the Midlands. V is in Cardiff, which has slightly separate accreditation, which we can come on to in a minute. And then Kate, who is in Windsor. So what we did, we decided, okay, let's be bold and let's just go for it. And very quickly, BSLM was coming up in last September in Newcastle, and so we just went for it. We worked flat out to try and get things ready. Went to the conference, and we were expecting maybe 5 people to be interested in what we were offering on our stall. I can't remember the exact figure, but it was about 140 or 160 expressions of interest. And it was like, oh my gosh, this is huge. So we had some Q&A sessions. Not everybody had the diploma at that stage. We had some Q&A sessions. People were asking really good questions. And then because it's taken a bit of time since then, because we've had to go through trademarks, license agreements with solicitors. It's always money. You're always giving out money and not, and it just seems like, and time and effort and all of that. So we set up the alliance, and in the last couple of months, we've got 2 onboarded associates. They are working with us in 2 geographical locations, one in Norwich and one in the south near Salisbury and Andover. And we're really, really happy to be working with people, and the current feedback is exactly the same. So it's a real, I don't know, there's something about community. There's something about doing it with other people. There's something about doing things together, and an alliance in particular. And not only that, you feel like you're creating a community, and you're, if I can use the term, spreading the word a little bit.
Yeah.
You're kind of thinking, here's this uncover risk, prevent disease, and now we're doing it in 2 other locations.
Yeah.
And empowering doctors to be able to do that.
And the ripple effect of that, obviously, for the patients is huge, and getting the word out there. But actually, the way that I see it from the doctor's point of view, with all of these huge hurdles that you have to jump through that we can touch on, you're making that process a lot easier for people who are not wanting to go out there and do all those things to start with. And before we started, we were talking about, say, let's talk about a person that comes out of the back end of BSLM.
Yeah.
Maybe is working 2 days a week as a GP, has got this newfound knowledge, and really wants to do something with it. Often the people I work with are not looking to leave the NHS necessarily, but they're looking to do something that they have a little bit more control of. on those days that they're not working in the NHS to possibly maybe shift that balance as they go through their career a little bit. So they're doing it more, but they're not wanting to just up and leave. And I'd like to touch on why that's important in a minute. But what I'm coming to is that they want to fill, maybe for those 2 days, run a clinic somewhere. So you want to have 1 day a week running a clinic out of, in Chester, for example, if you live there.
Yeah. Yeah.
Like if you want to do that as an individual, there are lots of hurdles to jump through to do it. You can find CQC premises, but to be CQC registered yourself is a heck of a process, isn't it? And I do have a podcast number 2 is with Tracy Jones, who is one organisation that helps people through this. But I know people get very confused at this point. So if I'm that person and I want to do 2 days a week, but I'm just a bit stuck and lost and I don't really want to make big financial commitments in terms of putting down lots of money to get started or rent somewhere, how would that benefit me? How can that person work with you in theory?
So it would be, obviously you would express a desire and we would then send you some information about what we're about. You can do it individually if you wanted to, but there's obviously this governance structure about safeguarding and policies. We've got over 40 policies, along with, even down to the hand washing audits and all that kind of stuff you have to be able to demonstrate. If you're interested, we will have another conversation. We'd then ask for 2 references. We would have to do what's called a fit and proper persons check. So we'd have to check you're on the GMC register, check your qualifications, all of that. And then what happens is we have a one-to-one meeting in the context of, are we a right fit? So we're not, I hope I don't sound rude in saying it, but we're not on a recruitment campaign. We're not kind of, oh, you must join us. We're kind of saying, actually, here we are. We're a great bunch of people. If you want to join us, then great, you can join us and we'd love to have you on board if we're that right fit. As a result of that, what we do is you'd then sign a license agreement, which allows you to use our trademark, to use our name. You'd always be in association with us. And that's the CQC thing, obviously. Some people talk about these umbrella companies and actually, can I just have a chat with you and then use your CQC and do what I like? No, you can't. I'm the registered manager. I feel like a practice manager half the time because I've got to check mandatory training. Once a month I'm going through, Richard's BLS is up next month, or Kate's cyber governance teaching, whatever it is, we always need to keep an eye on all of that. So you would pay us a monthly subscription for all of that to happen and to have access to the clinical software and the access to our templates and to have a space on our website to be able to promote what you're doing.
Yeah.
Does that answer something?
Yeah, absolutely. And then that person can then go out there and they can do some sort of front-facing marketing if they wish. They can go on LinkedIn and Instagram and everything and have the link just going directly to Hexagon Health, where they can then have an appointment.
Yes.
They book an appointment and wherever they are in the country, they will see the patient there.
Wherever they are in the country, they would see the patient there. Exactly. And it isn't just a case of you can work from wherever you want. If you're working from a premises in particular, you have to have done a risk assessment. So that risk assessment is based around even down to the, when did they last run a fire drill? It really is all of that detail. And as a result of that, we're able to offer you the kind of security that we're looking at after all of those types of things for you, and you don't need to worry about it.
Yeah.
I think the whole thing about CQC premises is all that really means is if you wanted to associate with us and use software, etc., if you work from a CQC premises, you don't need to do the risk assessment for the CQC premises. As far as I'm aware, if you wanted to be a lifestyle physician and you wanted to work out of a CQC premises, you still need to have CQC status. It's just the location that's covered, but not necessarily all of the other stuff. Don't quote me on that, but okay. That's where I think our cover in terms of everything else comes into place. Otherwise, there's no mandatory training supervision and there's no anything else.
Okay, so if in doubt, a conversation with you guys or with CQC directly.
100%, yes.
Yeah. Okay, and we'll link everything up in the show notes below. So yeah, it is confusing, and so many medics get their knickers in a twist about it. It's really frustrating when other healthcare professionals don't necessarily need to go through these hoops to be able to practice. But it's just the way it is. That's the
it's such a shame because we're actually a really low risk service, aren't we?
Yeah.
Not prescribing. If anything, we're de-prescribing and we're offering lifestyle advice, but we still need to be registered in the same way as if we're doing cosmetic surgery. It's ridiculous. But
crazy. Okay, well, let's go on to the lighter topic, and then we will get all of your advice. But you've mentioned team, you've mentioned community.
Yeah.
And you're obviously working, there are three of you, old friends. How important has it been for you to think bigger than just yourself and to be part of something with other people and to now be bringing other people in? How important is team and community to you?
So if you didn't know, I also have an occupational health company. So I came out of my partnership after I was a partner for a total of about 16 years, actually. And I came out of that and decided, stuff it, I've had enough of the NHS. This was 9 years ago. And I decided to set up an occupational health company because I'd also done the training in occupational medicine. I did that using other companies. So I was kind of subcontracting. And in subcontracting, I felt that it was quite isolating, but at least I had some connection with other doctors. Then COVID happened, and obviously you're even more isolated. But it also allowed me to be able to market my own company, occupational health company, in a way that I wouldn't have done in any other way. And I think you hear a lot of people who say COVID actually did me some good in the sense of it allowed me to focus on something a little bit differently. I found that actually still quite an isolating experience. So when I went to BSLM and V used this, Vian used this term, I found my tribe, and I'm thinking, oh, that's the first time I've ever heard that. So I went along to the BSLM conference and said, okay, yeah, I'll do the diploma, and I found my tribe, and I was suddenly overwhelmed with, oh my gosh, this is incredible. So to work with V again, who I'd worked with for 10 years, and to meet Kate, the three of us are just so different and yet so similar. We just complement each other in so many different ways, and we challenge each other in all those ways. So it's massive. It's massively important, And as I say, a problem halved is a problem shared, but we've got that three ways.
Yeah.
And we've also got the three-way investment. So we're not having to share the burden of a massive investment. We've each spent, I'm not going to underestimate, but tens of thousands of pounds each on actually setting up a company, making it happen, because we wanted to do it properly, and have a really good product at the end of it. So that's essentially the importance of team for me. We meet weekly. I'm at home at the moment, but the two of them, V and Kate, are on their way to spend 3 days in my home talking about Hexagon. We love to be together, and it's a really good professional relationship that we have with each other. It's quite special, actually.
Yeah, it really is special. And I think I totally get that. And with with Polly and I working together, I think we have the same thing. We filled each other's gaps because we've all got strengths and weaknesses. Actually, in a business, you can have that, that perfect fit of your, big thinkers and your practical people, and you're somebody that loves spreadsheets, somebody that loves picking up the phone. It's amazing. Not everybody has that. And if you're alone, if you are a lone wolf or a sole trader or whatever, then you can get out there and meet people in lots of different ways. And I work now a lot with subcontractors. So I only work with people that I really enjoy spending time with. And I've built a team, but I'm not employing that team. I work with that team. So it's really important. It's very lonely on your own, as you've touched on. I think the financial investment, I'm glad you touched on that, because I think people massively underestimate.
Totally.
They think that they're going to, people think that leaving medicine to start their own business is going to be some sort of utopia where they're going to end up, sitting on a tropical beach, sipping cocktails and answering a couple of emails, which obviously would be great.
Yeah, the 32 of us will go there, Joe.
Yeah, well, that'll be the next retreat.
Yeah.
Brilliant. So in terms of what about, let's say we talked a bit about struggles and difficulties, but what about what you'd say to somebody else? So somebody else in maybe the position you were in, maybe even before your occupational health, because I think you've obviously had an experience of running a business, and most medics haven't had that experience of running a business. So I always feel that there's an awful lot of stuff that has to shift. There's a lot of mindset work that needs to be done that people don't realize. People come to me and they say, "Oh, can I have a logo and a website? And how many times do I need to post on social media?" And I'm like, just forget all of that. Let's just start at the beginning. So I know you will have come across lots of things. What would you say to somebody starting out? What's your advice? What are your top tips?
My top tips, I think I would say it's not as easy as you think. And I think you have to be prepared for that. I would say it takes sacrifice. I would say it takes perseverance. I would say, and I'm not trying to be negative, but I'm trying to be realistic when I say expect setbacks. Having to be CQC registered for us was a massive setback, but actually it springboarded us into Hexagon Health Alliance. So you've got to use those setbacks as set forwards is the kind of the phrase that I use to myself. You've got to use it as a springboard into something even better. I was talking to my wife, my very wise wife, just prior to this podcast.
Your wise and patient wife, can I just say?
My wise and patient wife, yeah, exactly. And I was talking to her about it, and it was almost like, well, what would you say to somebody who's starting off? And I was trying to explain what I wanted to say, and she said, "Don't try to be an expert in something you're not an expert in." And I thought, oh, she nailed it. Yeah, and so for us, yes, I designed the initial website. It went through 3 different changes. We spent loads of time on it. We had a logo. It was great. We felt, wow, how proud are we of that? But it wasn't getting any hits because we weren't doing anything about it. And so what we then decided to do is to pay a marketing person. So we paid to go on. I can't remember exactly what it was, but the girls have found your courses very beneficial in that sense. So it was along those lines. But what it really helped us to do was to focus on actually you need to pay people to do this stuff if you want the right quality. So we did this in the middle of last year, so 2024, just before BSLM, and we suddenly had, we asked this lady just to give us some ideas, and she came back with a whole new brand design and logo design, and I'm actually quite, oh, hang on a minute, we didn't ask you for that. Oh, but that's really, really good. And so she obviously got us into her marketing way of thinking, because actually what she created was phenomenal. And it's the logo that you see on the website now. She helped us with the website. We're really pleased with it, and it took it up a massive notch.
Yeah.
So don't try to be an expert in something you're not.
No.
And if I could be really honest, I would say don't give up. I think I've certainly in my head had recurrent self-doubt, self-confidence, and exactly what you said. When you work in a team and you complement each other, when you're having a bad time, the other one's having a really good time, a really good day, and suddenly you think, oh yeah, no, it is okay. And then when they're having a really bad day, I'm having a really good day, and no, this is brilliant, let's go with it, and they're suddenly better. So it's that kind of thing. So expect certain things to happen, because they will. Pay the right people to do the work for you if you can, and don't give up.
Brilliant. I love those. I'm going to put a little adjunct in there. I think paying the right people to do the work is really important, but not necessarily at the beginning. I think, you've got they're getting the right advice from the right people at the right time.
Yes.
Because I think a lot of people that I see have maybe paid for that marketing person, have maybe paid for that swanky website, have maybe paid for that app to be developed, without really being clear on their business vision, their goals, why they're doing it, what they really want it to look like. And that can be an awful lot of waste of time and money. So what you had was good enough, like doing your own website, doing your own logo was enough to get you started. to get you that experience, to get you, get that flywheel turning. And then you have to invest. And actually, as you grow a business, there's always something to learn and somebody to learn from. So finding the right fit for you at the time, I think, is key. And if you need marketing, one-to-one marketing help and advice, absolutely. But I certainly wouldn't recommend anyone does that right at the beginning. I think you've got to have the basics in place, haven't you?
Totally. And for us, by the way, that came, so we set up the business in 2021. That I'm talking about the marketing people and other things coming on board, and even your calls in 2024.
Yeah.
So that's like 2.5 years after we've started. So you've got your ideas, you've got your business models, you've already started networking, you're already out there. You kind of understand a little bit more about exactly how you want your product to work.
Yeah.
So no, I wouldn't suggest any of that at the beginning, like you say. So for us, that didn't just happen. That came after a number of years, actually.
Yeah, brilliant. And that don't give up. I think so many, it is so easy to sit there and think, do you know what? This is really difficult, because it is. And, it's like that whole choose your hard. Working in the NHS is hard. Running a business is hard.
Yeah.
Being a parent is hard. Like, everything has difficult times, and running a business is no different to that. But I think it's often really underestimated, particularly by medics who really don't understand that world often. So not giving up is key. Having people in your world that can pick you up when you're feeling down. If they're not business partners, make them part of your network or community. And that's another reason why I feel so passionate about bringing people doing things differently together, because there is an energy within those people that helps lift each other on these difficult calls. So that's really key. And I massively appreciate your honesty around money. I think that's been really helpful as well.
Yeah.
So there's a lot here, Richard. I'm really excited about the future for you and V and Kate. I can't wait for the next hen do whenever we have that.
Yeah, exactly. Yeah, I think my wife will be coming, Jane.
Exactly. I know. I love your wife. We had a great time at BSLM. She's she's your manager. She's definitely coming.
Yeah,
and it's great to see. It's great to see familiar faces becoming your, alliance team. And I'm just really excited about Hexagon Health and all the future that you have ahead of you. So thank you for being a part of this. And I will connect everything up in the show notes below. Take care.
Thank you.
I hope this episode has sparked some new ideas or challenged your thinking. Transitioning from medicine to business is not easy. It's about adapting our skills while embracing the unknowns of entrepreneurship. It can be nerve-wracking, but remember, you are not alone on this journey. Please feel free to reach out to me via direct message on LinkedIn or Instagram, or just shoot me an email at joe@bendylegs.com for support. And don't forget to grab the free PDF from the show notes, From Stethoscope to Startup, which is your go-to guide and resource for diving into entrepreneurship. Many thanks for tuning in. I will see you next time. Thanks for spending your precious time with me.
This has been a Monkey Pants Productions podcast.